Homework 2, Chapter 3, Question 3. What about Pseudomonas aeruginosa makes it especially problematic in burn victims and cystic fibrosis patients? Pseudomonas aeruginosa is a member of the gamma proteobacteria class. It is a gram-negative aerobic rod belonging to the bacterial family Pseudomonaceae. Almost all strains are motile by means of a single polar flagellum. Pseudomonas aeruginosa is a common cause of healthcare-acquired infections. As an opportunistic pathogen, it readily establishes infections in people with weak immune systems, damaged skin, or other underlying health conditions. P. aeruginosa is an opportunistic pathogen. It is the epitome of an opportunistic pathogen of humans. The bacterium almost never infects uncompromised tissues, yet there is hardly any tissue that it cannot infect if the tissue defenses are compromised in some manner. This is a serious problem for immunocompromised patients hospitalized with cancer, cystic fibrosis, and burns. Its ability to form biofilms on indwelling devices, such as catheters, as well as in a variety of tissues, allows it to cause a number of infections. Pseudomonas aeruginosa has very simple nutritional requirements. It is often observed growing in distilled water, which is evidence of its minimal nutritional needs. It is tolerant to a wide variety of physical conditions, including temperature. It is resistant to high concentrations of salts and dyes, weak antiseptics, and many commonly used antibiotics. Okay, in cystic fibrosis, cross-contamination between CF patients is very prevalent, so the Cystic Fibrosis Foundation has set guidelines to where they must be kept 6 feet apart. P. aeruginosa attacks CF patients via the airways, and once it is in, it uses its flagellum to go to the hypoxic zone, which is an oxygen-depleted environment. At this location, P. aeruginosa undergoes a transition from an aerobic to an anaerobic microbe and starts forming biofilms anaerobically. Once this is formed, the P. aeruginosa in this community can sense their population via quorum sensing. This gives them the ability to resist many defenses, including anti-Pseudomonas antibiotics. Once bacteria sense that their outer layer of biofilm is being destroyed, the inner layers will grow stronger to reestablish the community. There's a movie about it. I haven't read it though. Okay, following severe skin damage, such as in burn victims, the prevalence of P. aeruginosa in the environment increases the probability of the organism accessing the bloodstream through the deep exposed epidermal tissue, leading to sepsis. Topical therapy of burn wounds with antibacterial agents, such as silver sulfadiazine, coupled with surgical debridement, dramatically reduces the incidence of P. aeruginosa sepsis in burn patients. There is a study, it was performed in 2019 by Ohio State University, with the use of electroceutical wound dressing to treat Pseudomonas aeruginosa biofilms. There has been recent interest in using electroceutical dressings, which use electric currents or fields to eliminate biofilms and to facilitate healing in chronic wounds. The data from this study indicates that electroceutical dressings are successful in treating biofilms alone. However, combining them with specific medications, such as with antibiotics, is more effective in eliminating the biofilm. This type of dressing is also useful in preventing new infections with biofilms. And I have attached the link. I thought that the study was actually very interesting.